What would you do if you were suddenly diagnosed with a serious medical condition without even consuming the cause? Alcohol in this case. And that's exactly what happened to a man in China, and his story is incredible. This case stumped experts for years. A man in China developed alcoholic fatty liver disease despite never drinking alcohol. Crazy, right? But as you'll see, there's actually some scientific explanation behind it. Let's dive in. Scientists were completely perplexed when they discovered that this supposedly sober individual had consistently high levels of alcohol in his blood without ever touching a drop. They eventually traced it back to a specific type of gut bacteria called Klebsiella pneumoniae. This bacteria converted glucose into alcohol inside the guy's own belly, like he had his very own microbrewery in there. And guess what? He's not alone. In fact, around 60% of people with fatty liver disease in the study had these boozy bacteria too. Let's talk about another crucial factor that can contribute to fatty liver disease. That's insulin resistance. It's the biggest indicator, increasing the risk a staggering 15 times compared to those who are insulin sensitive. Now, you might think only overweight individuals are at risk, but that's not the case. Even lean people can develop fatty liver if they have insulin resistance. Fatty liver used to be brushed off as no big deal. Recent studies have shown just how serious it can be. It serves as a gateway to more dangerous liver problems, all connected to insulin resistance. Once fatty liver sets in, inflammation can occur, leading to scarring known as hepatic fibrosis. Shockingly, half of those with fatty liver will end up with fibrosis. But wait, there's more. About 1 of every 5 people with fatty liver will progress to cirrhosis, and that can eventually result in liver failure, which requires a liver transplant for survival. Definitely not a great trade-off, right? Who would have thought that what's happening in your gut could have such an impact on your liver? Take care of your liver and your insulin resistance.